I use a little ice just to basically reduce any chance of bruising. It doesn't, after we have to do a little bit more. So if you notice, it's just really not a bad injection. And we go kind of deep in there, because if you saw that skull, there's not a lot of obstacles up there. And
I don't feel anything.
that's kind of it. I mean, it's really anticlimactic practically. And then just a little bit in front of the ears. And then just a little bit back by the, where her masseter muscle is, and you saw that bone that was decreasing on the aging skull, unfortunately. So that helps keep everything right where it's supposed to be. And as you can see, it just really doesn't feel like much of anything.
It doesn't feel anything. Awesome. I can have that every day.
Now, will she see a little something going on in the...
What I always tell everybody, especially if we do 2 vials, is go out to dinner that night because you've got all this water and you look great. And then she'll start to see something, well, about 2 days later she'll look back to normal. In about 3.5 to 4 weeks, she'll start to notice that you just get up in the morning and things are looking better and better.
Any bruising with this?
Most often not. I have done people on Plavix, which is a blood thinner. I've done people on aspirin and maybe a little dot here and there. And I did have one on Coumadin, which is not contraindicated, but if somebody's on Coumadin, there's usually a reason not to stop it. So that one had a little bit of bruising, but that's really extreme. I mean, sure, Coumadin. So then we put just a little bit right into here, which picks up the nasolabial fold. It feels just like a little mouth and muddles. You feel a little bit like you went to the dentist because of the lidocaine, but that wears off very quickly in about 20 minutes. And I see a little indentation there, so I'm just going to go in right there.
I'll tell you, I see a difference between left and right side already.
It is, because that's the water volume, but that's kind of a pre-indication of what you might end up with. And I'm just going to stick a little bit where she's got so much. See how the muscle, this is a good example, it's called Pota Orange, how the muscle adheres to the skin. And that's why you get the little dimpling on the chin. So you can actually fly with it too, it doesn't really hurt anything.
Mm-hmm.
These are artistic.
Mm-hmm.
Placement.
And that is it. So once again, this is what the massage would kind of look like, and she's going to be doing it because I will keep track of her.
So you put in, this was 1 vial or 2?
This was 1 vial. It was 9 cc's.